So, Dr. Rupesh, now we continue the discussion on the advantages of corticobasal implants.
Sure.
So, we've covered the part of immediate loading and how we are able to avoid wait periods
Wait
of
period.
3 or 6 or 12 months, and how we finish cases in 3 days.
Right.
And now we come to the next advantage of single stage surgery.
Yeah.
We are able to do just a single surgery, and that is it.
Because many a times, the patients when probably many of them would have researched in what you call the WhatsApp University or
Yeah.
YouTube University.
Yeah.
Many of the patients would do researches before probably coming and seeing you too.
Absolutely.
So when you think of many of the patients would have this thought disturbing their mind,
Yes,
the apprehensions
Yes.
that anyway it's going to be a surgery on my mouth.
Yes.
So will it be a something which they open up?
Yeah.
Will it be painful? Pain is another major concern for most of these patients.
Yeah.
So I'm sure most of our subscribers would like you, Dr. Prasanth, to explain to them as to how the surgical procedure, how it differs, or if at all there is any difference between a conventional option to your corticobasal implant surgeries, if there is any advantages to the patients there.
Yes. Yeah. So that is essentially this is the thing. So it is just a single stage. There's no question of a second stage surgery. There's no surgical work.
So I think the audience also may not know what first, second stage would be.
So very often this is what happens. During the first stage, the implant is placed. It is inserted into the bone after they open up the gum.
Correct.
And it is closed, and this healing is allowed to happen. And then the implant exposure, re-exposure of the implant happens through the second stage of the surgery, which happens after 3 months or maybe 6 months. So that is a second stage surgery, as you can see in the image here. And then you place the crown.
Right.
Okay. Now, in the case of bone grafting, then it becomes a lot more complex. So what happens? They do the grafting first, and then you have to wait for at least 6 months, and then you place the implant, and then you wait for another 3 to 6 months before loading of the teeth. So we are able to bypass all this and compress all this into 3 days, which is a lot faster as far as the patient is concerned.
Yeah.
And then the other huge advantage here is that we employ keyhole surgery techniques. We don't open a flap. We just use a drill, pilot drill, and then we drill in and we go anchor it in the right bone. We drill into the right bone and then anchor the implant into the right bone. So you have lots of advantages. There's no bleeding. There's very minimal bleeding, and the patient recovery is much faster.
Right.
So you can see the steps here. We just go in with a pilot drill into the soft tissue, then go into the bone, and then finally we screw the implant down.
Right.
That's it. So that is the huge advantage with corticobasal implant system.
So the patient comfort level, the comfort factor
is considerably more.
And the healing phase probably would be much lesser.
Yes, it's considerably more. Yes.
Right.
That is a beauty. Yes. So we hope you liked this short video on how the keyhole surgeries work and how single stage surgeries work in corticobasal implants. Please do like our video and do share and do subscribe to our channel. Thank you very much.
See you soon.